At this 67th ASH annual meeting, we have 3 abstracts presented from Beat AML. The first abstract we have presented is from Dr. Emily Curran from the University of Cincinnati, which is a trials in progress poster of the latest edition that we have as a subprotocol to the Beat AML master trial. This phase 1b/2 study is evaluating a monoclonal IgG antibody to hepatocyte growth factor in combination with Venetoclax and Azacitidine. We currently have 2 sites open for this study, and we have 3 SIVs scheduled for this month. So we anticipate within a year that we'll have some pretty good results of this study. The 2 other abstracts that we have presented are oral abstracts, which takes the massive amount of data that we have collected through the duration of the 9 years of the Beat AML master trial. The data that has been contributed to these 2 oral abstracts are from the frontline Venetoclax and hypermethylation agents that we have in combination with ven, with overall survival and all the clinical features. So the first abstract that is going to be presented is by Dr. Curtis Lakowitz of OHSU. And so what he has done is combined 8 data sets globally to come up with the largest data set for Venetoclax and hypermethylating agents in the frontline setting. And what he was doing was to further investigate the existing 4-gene prognostic factor for AML with treatment up here. And so what he's done is add additional clinical things into the prognosis factor, so doing age, whether they've had other treatments or secondary AML, to then further reclassify patients in the prognosis. So what he saw is that over 50% of the patients who were considered favorable under the 4-gene one had been recategorized to other levels. And so what makes this really important is for providers, when having additional information on their patients, to make sure that Veneza is the correct treatment for them by recategorize them into favorable, intermediate, and unfavorable. The second abstract that we have utilizing Beat AML data set is from Dr. Fieke Hoff, and she's at the National Institutes of Health. And what she did was combined, looked at different data sets of first-line Venetoclax and Azacitidine as well. But she was more interested in how NPM1 mutations co-occur with signaling mutations, such as FLT3, KRAS, and NRAS. And what she did was further went through there to see if it had an impact in overall survival. And what we did find is that patients who were NPM1 mutated but did not have signaling mutations had a greater overall survival. But when you have these signaling mutations, that overall survival decreases significantly. So what this puts out there is that for NPM1 mutated patients, Veneza works, but if you have these signaling mutations, you really do need to look for another targeted treatment to your Veneza regimen.